Good evening, Matt. I wanted to make sure that you could hear me okay.
Hey, Jennifer. Sounding great on my end.
All right. Thanks, sir. I'll keep myself muted until I get started. Thank you.
Yep, you bet. And I have it recording, so you'll be all set. I'll send it to you first thing in the morning.
Outstanding. Thank you.
I don't think that went down. EDH, virginia.gov/MRC/orientation.
Hi, John Herring. Is that John Herring? Oh, maybe he's gone. Okay, good. Looks like somebody figured out how to cut their microphone off. Very good. Good evening, everyone. We'll wait a few more minutes while some additional folks join us, and then we'll get started. If you can make sure that you can mute your microphone. Background noise, that would be great. The echoing is caused when someone is actually listening to the audio via their computer and also on their phone. So if you are using your phone, make sure the audio, your speakers on your microphone are cut off so that we don't get that echo in the instance that you accidentally unmute yourself. So we would appreciate that. Thanks so much. Stand by for a few more minutes. Hi, I believe that was Katie. She had posted a question. I'm hoping the presentation will take no longer than an hour and a half. Typical stand-up orientation is about 2 hours, but I have condensed this, so I would expect no more than an hour and a half, perhaps shorter. And the presentation hopefully will be recorded in a good enough quality that we can share it with folks later. So if you have to drop off early, you can still get the rest of the presentation. All right, good evening, everyone. Thank you for joining us tonight for our just-in-time COVID-19 Medical Reserve Corps volunteer orientation. Please make sure that you keep your phones muted. Any background noise is quite distracting to myself and others. So if you can make sure that you know how to mute your microphone, that would be much appreciated. I will apologize. I've tried to make myself as soundproof as possible, but I do have 2 security officers and full mask and a Ring doorbell, so occasionally you might hear some background noise. I apologize for that. So if you can make sure you mute your mics, we'll go ahead and get started. I have posted the presentation slides on our orientation webpage, and you can go and download the slides there. And hopefully you'll be able to follow along just fine, or perhaps you're looking at the slides and you're only listening to audio. All the same, hopefully the presentation will convey either way. If you have questions, you can post them in the chat box, and I will try to get to those at the end of the presentation if we're not running too long. Otherwise, you can also reach out to your MRC unit coordinator. So, good evening. My name is Jennifer Freeland. I am the State Volunteer Coordinator here at the Virginia Department of Health in the Office of Emergency Preparedness. I coordinate all the Medical Reserve Corps units across the state and are over 10,400 registered volunteers and 7,700 deployable volunteers. And those numbers are growing daily and quite quickly as we are really starting to ramp up our efforts to respond to the COVID-19 pandemic. What I'd like to go over tonight is to give you really a good grounding of what the Medical Reserve Corps program is, a little bit of our history, why it's important to our communities, the role of public health and emergency response. I was new to the public health department over 15 years ago and didn't know what public health did, nor did I know that they even had a role in emergency response. So I'm hopefully going to share a little bit of what I've learned thus far and talk to you about what we do now in our efforts to start to respond to COVID-19 and what we'll be looking at potentially in the future to continue to support our response. I want you to understand your role, responsibilities, protocols, all the roles of being an MRC volunteer, and also to understand some of our training systems that we use. All of you have gone in and registered in the Virginia Volunteer Health System. So I'm going to give you a little bit of a tour to make sure that you understand some basic operations in our system and tell you about our online training system. Then we'll talk about the next steps for the evening. So let's go ahead and get started. So the Medical Reserve Corps program was started after 9/11. A lot of people wanted to help. I actually worked at a volunteer center and answered phone calls of all the volunteers that wanted to go to New York City and help, much like the phone calls that we're getting today of volunteers wanting to help with COVID-19. Sometimes in those very stressful conditions, very austere conditions, if it's a hurricane, people are not just physically and mentally prepared, and it becomes a risk or a hazard for them actually to respond. But we identified that there is a need to be able to mobilize very qualified and willing volunteers to be able to support our emergency response efforts. So recognizing that in the federal level, the Assistant Secretary for Preparedness and Response houses the Medical Reserve Corps program in the Office of Emergency Management. It actually started in the Office of Surgeon General at the very, very beginning. We've now transferred over to the ASPR program. At the Virginia Department of Health, the Medical Reserve Corps program is a program, an entity of the Virginia Department of Health. We're not a 501c3. We are a government-managed public health volunteer program. Our program sits underneath the Office of Emergency Preparedness. That's where I am located, and underneath the Preparedness, Public Health and Preparedness Division at the Office of VDH. And then every local health district, of which you will be affiliated with, a local health district or MRC unit that is in a regional health district, has an office as well that supports emergency preparedness and response. We are fortunate that we receive funding to be able to support the development of this program. It is funded through the Center for Disease Control, Public Health Emergency Preparedness Funding, the Hospital Preparedness Program, the National Association of County and City Health Officials and Localities, and there's a lot of different funding sources. So we don't go and raise money. We are supported by federal, local, and state dollars to be able to make this program a success. So our mission as volunteers in a huge volunteer program is that we are able to engage community members to supporting important community public health initiatives and also to respond to emergencies. So I know many of you are coming because of COVID-19, but this is one of the many responses and hopefully an abnormal response, not something that we do all the time. We have a lot of ongoing activities that we do throughout the year to support and protect our community's health. So I put up a map. Hopefully you'll be able to see it well enough that you can perhaps locate where you are residing right now. And you can see the different outlines for our MRC units across the state. We do have 22 Medical Reserve Corps units. Each unit has a unit coordinator. Some units are single locality units, for example, Alexandria, Arlington, Chesapeake, Portsmouth, Norfolk, Virginia Beach. They have one unit, and that's only their one city, one locality, but everybody else is regional. So some of the MRC units cover a very large area, especially when you get out towards the southwestern part of the state, and you're with Christina Morris in Southwest Virginia, Mary Lou in near Southwest, or Chris in Northwest, those are huge areas. The color is actually what we call healthcare coalitions, and especially during our current response, public health, hospitals, healthcare system, long-term care facilities, all community partners that are responsible for health all work together collaboratively. And that is proving to be crucial for our response efforts today. Sharing resources and people and coordinating efforts it's critical. And we're finding that the groundwork that we've laid over the last, probably about 17 years has really benefited us. So what we're doing with COVID-19, although it is probably the scariest thing that many of us have experienced as far as public health is concerned, we have had public health emergencies before. This isn't new to us. We had H1N1, and that was kind of the first start of declaring public health emergencies by the state health commissioner. So many of the efforts that we did during H1N1 are things that we're putting in place and we're doing right now for COVID-19. We had Ebola, so isolation and quarantine for Ebola. We learned from that, putting those lessons learned in practice today. Zika, and then the opioid addiction is an ongoing, it's a public health emergency. It's an ongoing challenge in many of our communities, and we continue to do things to help to fight the opioid epidemic. So public health and emergencies, and how many people think emergencies, that's the firefighters and police officers and, you know, the EMS and the ambulance, but we kind of have a backseat responsibility behind the scenes. I really kind of think behind the scenes responsibility for the overall arching health of the community and really all aspects of health when you get into the Virginia Department of Health. And I'm not going to go into the details about everything that we do at VDH because it is quite vast. I'm going to focus on the emergency part. So we are responsible for the coordination of medical, public health, mental health, and EMS services. Actually, the Office of Emergency Medical Services is within the Virginia Department of Health. The only agency that's not in VDH related to this is our Department of Behavioral Health and Developmental Services. They're a partner agency right across the street from us in Richmond. But the State Health Commissioner has the responsibility ultimately of coordinating emergency response for those efforts. And it falls down to each of the local health districts and local health directors to take on that responsibility at the local level. The conducting active disease surveillance and investigations is a huge responsibility, a lot of data crunching, a lot of phone calls, and is what we are really in the trenches doing right now for this COVID-19 response. We will, in the future, be looking at our efforts for mass vaccination. We exercise every year for mass vaccination efforts by doing flu vaccination clinics. So we're constantly practicing. And then we're also responsible for, in any mass care situation, providing basic public health oversight, providing first aid or coordinating or providing first aid and medical assistance to special needs populations. So let's look a little bit about our timeline. I am not a public health expert. I am not a medical healthcare provider. I have no expertise with that, so I cannot provide you with any medical advice. I'm not the state epidemiologist, Dr. Peak. She's fantastic if you've seen her on videos. So I'm going to provide you with just some of the facts and basic facts, and I'll refer you, of course, to the experts to provide more information. So as you all know, they detected COVID-19 coronavirus in December. Our first case was in March. Shortly after, World Health Organization declared it an epidemic, and then our governor declared it a state of emergency on March 12th. So today, and we always have to say currently and today, because things change every 30 minutes to every phone call to every email, things can change very quickly with what we are doing. So currently we have 77 cases. 1,278 have been tested. Now those testings are occurring at the state lab, which is primarily where we were first started testing, and that's why the testing was a little slower at first. But now many private labs, healthcare systems, Centera if you're in the eastern region, and LabCorp are all starting to do testing. So we're going to see these numbers increase daily significantly because just more testing is occurring. You can see there's obviously some hotter spots in the state. We've got clusters. I think there's 2 to 3 clusters of breakouts in James City County, and then we have up in the northern region, Fairfax and Arlington have our most cases. I believe they have 14, and the Peninsula Health District has 15 or something like that. Breakdown exactly. Now, these numbers are updated every day at noon. So be careful on social media what you see, because some posts are posts from, could be 2 days ago and the numbers are lower. So make sure that you're constantly going to our website. This website is updated every day, if not, I would probably say it's updated at least 3 times a day. Every day at noon, the numbers for the cases are updated. Also, you will find that the governor and the Unified Command does a briefing every day at 11:30. It's posted on Facebook and on the governor's page as well. And it has a briefing. It includes usually the state health commissioner, our secretary, Dr. Carey, the governor, and usually the head of the lab for Virginia is in that conference as well. It's usually about 30 minutes, but it's very good for you to stay updated to know what is happening in Virginia. There's a lot of information out there. World Health Organization, CDC. We get our information from CDC. We use the data that we have in Virginia to make guidance and decisions about what we need to do in Virginia. But if you want to know what's going on in your community, in your state, you need to come to our website. Sounds like somebody's mic is unmuted. Oh, looks like somebody took care of that. Thank you. So I'm just going to talk about some of the main community actions that we're focused on right now. Cover your cough, wash your hands, stay home when sick, don't touch your face. Those are all things that, we say every year for flu season. For H1N1, cover your cough, wash your hands, stay home when sick, and get your flu shot. That is a constant message that we're having to reinforce, make sure that. Yeah, if y'all can make sure your mic is muted, that would be much appreciated. Also, one of the more challenging things for our society to adapt to is social distancing. It's probably a good thing we have social media, but we really are going to have to maintain the space of around 6 feet from each other. And this is going to be very important for reducing that curve and bringing it down so we can contain the spread of COVID-19. This is going to be critical for us in reducing the burden on our public health and our health system, because we do have some limited resources, and the less burden we can put on the hospitals, the better. Not only for the hospitals, but the better for everyone, so that the people that need treatment can get treatment, and we can keep the people that can take care of themselves and get well at home. And it is all our responsibility for social distancing. As you may be aware, we're mandated no longer to congregate with more than 10 people in a space. So our lives are changing, but know that this is temporary. It's something that has to be done, and it is temporary. It's going to be a new normal, but we're going to get through it together. So our highest risk population that we've been concerned about is, I've heard 60, but just I believe it was today, CDC came out and said 65. I don't know that there's a magic number, but if you are a senior and you definitely have any of the chronic disease, things that make you more susceptible to any type of virus, this is of concern to you, and the recommendation is that you would quarantine. Self-quarantine, don't go out, stay in, take care of yourself, have other people help you. Hopefully, I don't know if we have many volunteers online that are 65, but thankfully I'm not 65. But what I'm going to be doing to help the high-risk population is that I do have neighbors that are older. I have one that has Lyme disease and has other chronic issues, and so I'm checking in on her, making sure she's doing okay because she's living by herself. And you know, it's going to take community. Much like it did after September 11th, everybody's going to have to be flexible and take care of each other. So encourage you to do that. Now, what are we doing as Medical Reserve Corps volunteers and units throughout the state? Our biggest mission right now is that we have volunteers that are staffing our public hotline call centers. Some of those call centers are locally focused call centers, and some of them are regional. We have a regional call center set up currently in Norfolk, but the entire eastern Hampton Roads area of Virginia goes out to their media markets. So we have volunteers there. In Alexandria, I think probably for almost 2 weeks, we've had volunteers and call centers there. Almost all the localities where call centers are open, Medical Reserve Corps volunteers are assisting in answering, triaging the calls and making sure people get the information that they need. Now, if you are a volunteer, you deploy to one of these call centers, you don't have to be an expert. We do provide training to the volunteers. We call it just-in-time, JET training, but we make sure that you know the scripts and all the answers to the questions that potentially would be asked, and there's always a subject matter expert there. But this is one of our big missions right now, is to make sure that a consistent, clear message is heard and that people take care of themselves and understand what they need to do to protect their health. Now, we also have another aspect of that is working with healthcare providers. So here actually is a physician in Henrico who is retired and came in and helped the epidemiologist return phone calls from healthcare providers. So it is important that they understand, you know, the testing requirements and the risks and things, PPE recommendations. And so there is a lot of communication that goes back and forth between the health department and the healthcare providers. In Alexandria, because the area is a little smaller, previously the volunteers were actually walking in the community and providing, hand-delivering information to healthcare providers. So it's important that we maintain the relationship and the open communication within everyone in our health system, the hospitals, the healthcare providers, long-term care facilities, and everything. And some of our volunteers are actually working at home and making phone calls to make sure information is updated for our long-term care facilities, daycare centers, and the such, so that we can make sure that we can contact them in an emergency and they know who the health department is and who to contact. So there's some investigation, some data scrubbing that's going on in the background, and some of those activities are being done at home by volunteers. Now, this past Saturday, we had volunteers being trained for our point of testing and also being fitted for N95 masks. Today, we had 15 volunteers from the Chickahominy, Henrico, and Richmond City Medical Reserve Corps units staffing a point of testing site in the Richmond area. It was 80% staffed by Medical Reserve Corps volunteers, which was fantastic. I hear they had a great day and everything ran smoothly. I would expect, and testing's going to look a little different in every community. I'm actually here in Suffolk, Virginia, in the Hampton Roads area, and I know of somebody who went through a drive-through testing down in Chesapeake, and it was run by a health system. So, there's no wrong gate, really. We want to try to open as many gates as possible to allow people to get the testing if they need it. And so we'll be working and coming up with creative ways to do so. And this is actually an example of not drive-through testing, but this is the Portsmouth Medical Reserve Corps doing drive-through flu vaccination clinics. So what's interesting with this is that we have been using this drive-through model of providing some type of health service for many, many, many years. Sometimes it's driving through a parking lot. Sometimes it's driving through a rescue squad. It can be a lot of different locations. In public health, we've had to be very creative with the resources that we have to think about how we can go to where the people are and get the most amount of medications, vaccinations in people's arms as quickly as possible. Now, medications don't go in the arms, but we call it pills in people's or shots in arms. How fast can we get it done? And the fastest way sometimes that we can do that is through drive-through. And so we do practice that every year. Every year, all of our health districts throughout the state do community-based flu vaccination clinics where we actually have to count how long it takes for someone to drive in, finish the paperwork, put the shot in the arm, and drive all the way through the point of dispensing site. Now, as we're going through testing, we're calling them point of testing, so they're now POTS instead of pods. So we're doing the point of testing site, so instead of shots, we're swabbing folks and getting samples, and we'll be being as creative as we can be to be able to get that done. And so what it looks like, and here's the one thing, I don't know where everybody is on this call. You could be out all the way at the tip of Virginia. You could be in Northern Virginia. You could be sitting in Lynchburg in the hills and in the valleys. Every community is different. Virginia is very different from one end to the other, and it's a long state. It's like 8.5 hours from where I am to the very tip of Virginia, out west. And what a vaccination clinic looks like in one community will be different. Alexandria in Northern Virginia, they're not going to have a drive-through, maybe point of testing, because traffic up there is pretty darn bad. They might figure out another way to have people come through and do testing. It really will depend upon the area, the road systems, the resources that are available, to how it would look in each community, but we are working really hard to be able to make testing as available to as many people as possible, and we are going to need volunteers to help us do that. If it's going to be a health department, managed or co-led point of testing site, we will need volunteers working alongside of us. And I say that my supervisor is the director of the Office of Emergency Preparedness, and he often says that our Medical Reserve Corps volunteers are our staffing augmentation, our surging workforce. And really, it's amazing to us how quickly volunteers have mobilized and how willing you guys are to help us with this response. And truly, you are a force multiplier. Public health is pretty small. We don't have a huge healthcare system. But let's talk a little bit about COVID-19 future. Crystal ball, it is potentially, of course, we're going to get vaccine and we'll do mass vaccination efforts. And it will look like the drive-through. It will be, this picture was taken in a gymnasium. It will be volunteers, yes, standing along the side of the road. This was in West Piedmont, Pennsylvania. No, West Piedmont, yes, in Martinsville. We had volunteers that were willing to stand along the side of the road and hold up signs to encourage people to get their H1N1 flu shots. I don't know, I think our signs might look better for this next COVID-19, but I know that we'll still have volunteers out there with smiling faces, encouraging people in the community to become vaccinated. Okay, great. I think Matt, or maybe thanks. And then one of our someone needs to mute their mic. I don't know if that's Bill or who it is.
Is sharing information, sharing what works.
Okay. Yay. Either they did it or Matt did it. Thank you, Matt, if that was you. One of the other efforts that we really have in public health is getting that public health message out. And that cover your cough, wash your hands, stay home when sick is a constant message that we say all the time in public health. Yet, you know, I don't think a lot of people have that part of their daily thought process, lifestyle. You know, here, this is a picture from H1N1. If you read what's on the sign, it says you should remain a distance of 6 feet from anyone in the immediate area if you're sick. Put on a surgical mask or move away from other patients. So this isn't, you know, the message that we're saying now for COVID-19 is no different than we do for regular influenza. And, you know, we did for H1N1. So that message has to get out there, and we'll continue to be pushing that. We have some volunteers that are in the process of being trained and have, actually, I think we already have a group trained up in Alexandria to do presentations that focus on cover, cough, wash your hands, stay home when sick, and fleas in your sleeves. We do have some really cool purple, I should have put the picture up here, darn, these purple units that we use that you can go and wash your hands and you put stuff on your hands and you put them in the glow germ and it shows you how poorly you washed your hands. And everybody really, it's a very good learning tool because people see that they don't go in between their fingers or on the back of their hand and wash like they really, really need to. So we really charge you as Medical Reserve Corps volunteers to be our public health champions. The message that we're trying to get out to the community that you will also help spread yourself. Personally, I monitor the COVID-19 website, and when there's new information about recommendations and guidance for faith-based and community organizations, I download that document and I send it to the pastor of my church. I want my church to understand their role in public health. I want my church leadership to understand how to protect our entire congregation. And I can be the messenger of that information, and so can you. If it's in your workplace, if it's in your church, or even in your own family. I know some of mine think I'm a little over the top because I'm constantly yelling at them about washing their hands and not touching doorknobs and all that. But we do have to be the champions of that public health message. So what else will be in the COVID-19 future? I'm not too sure. To be honest, I'm really trying to focus on Virginia, and I have not spent a lot of time watching national television and news. I'm 100% head in Virginia. There are conversations about utilizing volunteers perhaps for medical surge, potential need for respiratory therapists, potential need for nurses. We're looking at that. We're working with our healthcare coalitions to see where their gaps are in staffing and trying to determine how potential MRC volunteers could fill those gaps. So that will all be to be determined outside the scope of what we're doing right now and what we do in a daily public health is all in conversation. I have a saying, I have two sayings. All things are possible. We have to have some conversations about it, but My other saying is, and I always say, quote me on this one, never underestimate the willingness of a volunteer, because we might get asked to do some things that may not quite be in our scope, but it is never a surprise to me that we'll have volunteers that will step up and be willing to do it. So I would say stay tuned. And like what I said, every community is going to be different. So what's going to be happening in Fairfax is not going to be the same thing that's going to be happening in Norfolk or other areas of the state. So why do we need volunteers? We don't have enough probably nurses on a daily basis, probably within most health systems, much less in an emergency. This picture here is of some volunteers working alongside Centera healthcare system staff members. They're staffing a medical tent outside the finish line at the Rock and Roll Marathon. And those volunteers worked inside this mobile ED and were part of that medical surge, which potentially could be the utilization for volunteers for COVID-19 if a similar type of facility was set up. So we practice in a lot of different ways, which hopefully will help us be better prepared or better capable of responding to what we have in front of us today. So we do have a limited workforce. In public health, we have public health nurses, and our public health nursing skills are very different than nurses that are on doing day-to-day working in a clinic or working in an urgent care, and have specific skill sets working with geriatric patients. It is public health world, and there's a lot of different forms of nurse. A nurse is not a nurse. There's many different types of nurses. There's many different types of healthcare and a lot of different skills, and we need the variety of that in this type of response. So we need to bolster up the credentials that we have underneath of us to be able to respond to the entire community. We need caring individuals. It is just always impressive that we have people that will donate hundreds of hours of their time for free because they care for the community. I'll give you an example actually from H1N1. So for H1N1, we had very close, I think it was like 1,998 volunteers support over 743 activities for H1N1 response efforts, and the value was over $825,000. I have said that very easily, I think our COVID-19 response will be well over $1 million that we will contribute, volunteers will contribute in value of their time to the community. So very quickly, we're having to expand capacity and double, triple, quadruple our efforts. And we do need both support and medical volunteers. We do want medical volunteers, but about 60, I think we're about 70% of our volunteers are medical and 30% are non-medical. It depends upon each of the MRC units throughout the state. But we need people to help do paperwork, to help with logistics, to help enter data. It takes everybody to support a medical clinic. It takes everybody to do public health response. So we need the support of all types of volunteers. We have volunteers helping our Medical Reserve Corps coordinators because it's a lot to onboard a lot of volunteers in a short period of time. So we have volunteers that are helping us manage volunteer records and are looking at information in the Virginia Volunteer Hall system and are creating badges and doing all kinds of work to support our actual program. So there's a lot of different opportunities for volunteers, and truly we can utilize everyone to assist us. So how do we decide who is needed? We will get a request, and who is needed is going to be based upon the request that's received in the what we call a job action sheet. So for every emergency plan, there's a job action sheet, basically like an order form for a volunteer. or for any staff member, not just a volunteer. And we'll say, okay, let me see the job action sheet. I need to know, what color, how many, where do you need to send them, when do they need to be there? And so, like when we had our response to the mass shooting in Virginia Beach, we had a major call out for mental health professionals. And of course, there were mental health professionals all over the nation. There was people that showed up that weren't even requested. And we were able to work with the city of Virginia Beach. We mobilized a very well-qualified group of mental health professionals that provided direct support to the city of Virginia Beach employees. They did over 645 hours of volunteer service for free. They worked in crisis care teams. They did one-on-one and group counseling. They did amazing work. But we had enough people locally that we didn't have to ask for anybody in Richmond or Northern Virginia. And so when I went to other areas of the state, like, oh, well, I'm a mental health professional. I wanted to go. But thankfully, we had the capacity locally that we didn't need to mobilize people outside of the area of which the event occurred. So although, you might want to go, you may not be needed because we might have enough people there. However, when we had Florence and we set up a state-managed shelter at William & Mary, we didn't have enough people there because we were also staffing local shelters. So we mobilized a volunteer from up in Chickahominy, and she drove down to William & Mary and helped William & Mary at the state managed shelter. So who is needed, where they go, when they go, it's all dependent upon the event and the request and the level of care and services that are provided. So what does it mean to be a red shirt? Now, I always say red shirts because I think they're pretty bright, and they really are an icon of our program. But some of the MRC units have other color shirts. They have blue and pink. No, blue, I've seen yellow, gray, light blue. But pretty much everybody, we are red, white, and blue. That's our logo down at the bottom left-hand side of the screen. That's the MRC national logo. When you see local MRC unit logos, they'll have their unit name on top of Virginia. But we are a large group. People are often quite surprised when I tell them we have over 10,000 volunteers in the Commonwealth of Virginia that are willing to support public health. So let's talk a little bit about our expectations of what we have of you as a member. One of the most important things is that you cannot self-deploy. I make people repeat that, so I know y'all are all out there. I will not self-deploy. We ask that you do not self-deploy. You can be a burden to the response, impede our efforts, be at risk and safety to anyone else. So please do not self-deploy. Well, there are some required trainings. Orientation is one. Depending upon how you're going to deploy and what responsibilities you will be assigned, different training requirements may occur according to that role. We do have an epidemiological response teams. There's some specific outbreak investigation training for that that's provided online or by the MRC unit. We have some digital volunteers, so doing our virtual social media monitoring. There's specific trainings for that. So there's basic core training, and then there's specialized training. We need you to respond to alert notifications. If you haven't received an alert, I'm going to tell you a little bit about later, but whatever you do, please let us know. It's really important. You be dependable. We understand things come up in your life and you may not be able to show up, but we need to know that you can't come because that impacts our staffing and our ability to respond. So please let us know if you can't be there. Maintaining current information is really important. I'm going to show you how to do that in the Virginia Volunteer Health System. Responding to an alert. I'm getting an alert on my phone right now that volunteers are being mobilized right, can anyone hear me?
I can.
Oh, thank you. All right, good.
Yes, I can hear you.
Okay, all right, so then you know how to unmute your mic, so you promise me you're gonna mute it again. All right, so audio is working. Okay, very good. All right, so we just ask that you represent the MRC professionally. You come dressed and prepared as appropriate and as requested. The alert did not come on the same phone that I'm talking on, though. I have that phone muted over here. I just happened to glance over and seeing it ring. So that the alert didn't cause us to lose audio. I just want to make sure you know that. Okay, so again, don't go unless we ask you. Don't go somewhere and represent yourself as Medical Reserve Corps volunteer unless you're officially deployed with us. If you do that, we find out about that, we will remove you from the Corps. So just need to be absolutely clear about that. Okay, so we do have liability coverage for our Medical Reserve Corps volunteers. When you fill out your application, there actually is an acknowledgement section that has the liability information. If you log on to the website where we have had the information for logging in and for downloading the presentation, the next link below that is the liability and HIPAA acknowledgement form if you want to print that out and review it. Also, in many of the handbooks that are also listed on the site, all the liability coverage explanation is provided. So what is different about Virginia is that code was actually passed that specifically says Medical Reserve Corps volunteers and specifically says under the direction of VDH. So that's the reason why going without being deployed is a no-no, because you're not going to get liability coverage unless you're under our direction. So we have to follow our chain of command, and there's, of course, always good reasons for that. You will have the same protection as any registered nurse with the Virginia Department of Health. Our Office of Risk Management provides coverage. The only two claims that I've ever had in my tenure being the state coordinator over 12 years has been from 2 needle sticks from shot, vaccination clinics over 12 plus years. So we, knock on wood, haven't had anything serious, and that was real wood, anything serious happened. Someone I saw happened to glance up asked about, do you have to sign it? No, when you apply as a volunteer, there's actually an acknowledgement box, and it records the date that you acknowledged it. Some of the unit coordinators will have you sign the acknowledgement if you do an orientation in person. We're not going to be doing orientations in person. So reviewing it, the document I sent, and acknowledging it in your profile in the Virginia Volunteer Health System is sufficient. Okay. And then we have HIPAA that also is explained on the acknowledgement sheet that we have to abide by that act and follow all the rules, not sharing that who the person was that drove through the clinic, that you knew that person when you were in school, and we don't share any of that information of identity, what they came there for. None of that is shared for HIPAA. Everybody signed at some point in time a HIPAA acknowledgement is when you go to get care. So not beating that one. Okay, so who has access to your information? So you put information in the Virginia Volunteer Health System. It is a system that we use as Medical Reserve Corps coordinators. And in the Office of Emergency Preparedness, we have emergency coordinators to be able to manage and mobilize and move volunteers all across the state. So right now in the Eastern region, remember I talked about earlier that a regional team in Norfolk doing the call center. Well, the Norfolk MRC unit coordinator is contacting all the volunteers that have been put on that team, and that team has volunteers from different MRC units. So that MRC unit coordinator has access to all of the volunteers on that team. We provide the information to any of the VDH staff that need to know. So all the volunteers that went to the point of testing site, we would have provided perhaps information about the volunteer, about you if you had gone there and supported. We would have provided your emergency contact information in case something happened to you, your cell phone. If you were providing medical services, they would have had your license verification number. They would have known that your background investigation had been done. So all the critical elements. And when you do that acknowledgement for the liability, there's a section in there also knowing that you acknowledge that we are going to be sharing your information only as necessary for deployment. We don't mass email people, share email addresses, or anything like that. So we have a lot of training that's offered throughout the year. Many of the MRC units require what's called Incident Command System, ICS, and then National Incident Management System, NIMS. And I forgot to apologize very early on that we have a tremendous amount of acronyms in emergency response and public health, and much like in all of the branches of government. Seems like everything has an acronym, VVHS, the Virginia Volunteer Health System. So I apologize. I hope I did not glaze you over with an acronym of which I did not explain. I apologize if I did that. Anyhow, so we have psychological first aid or mental health preparedness. We do regularly provide life support certifications in different formats. We typically provide American Heart Association, so all volunteers have access to basic life support, CPR, first aid. We have volunteers that teach volunteers, which is fantastic. We do teach Stop the Bleed and Until Help Arrives are two of the courses. We also teach a course called Revive, which is using the opioid reversal Narcan. We actually dispense Narcan in the community and provide that training to the community. So there's a plethora of things that we do to try to educate you to be better qualified and capable of responding, and also that gives us an opportunity to educate the community at whole about emergency preparedness, and we do have presentations just on emergency preparedness. Annually, we do exercises. I don't think we'll be doing an exercise this year because this is going to be a very long actual response, but typically every fall we have large flu vaccination clinics. NIMS, so National Incident Management System. And actually, I will make sure that when I get done, I'll go back on the website and I'll put y'all the link to the Incident Command and NIMS, and I'm going to tell you about how you get to that training in just a bit, so hang tight. So we do have a lot of exercises. They are done in person. So this is the next thing. This is how do you get to that training. This is Train. So what's cool about this, don't go and create an account. If you just became a volunteer, you do not need to create a Train account. We have magic that's done between Train and the Virginia Volunteer Health System, and Virginia Volunteer Health System sends over to Train every night, hey, here's these 20 new volunteers that were approved. And so overnight, an account is created for every single new volunteer. So you're going to have an account in Train automatically created for you. So you don't need to go in and log in yet, but I am going to show you where you can find that information a little bit more about Train, because Train has just enormous depth of information about public health. CDC from resources all across the nation. So this might be of great interest to you personally or even professionally. The trainings are, we use them to register for trainings that are in person, for trainings that are web-based, and for trainings that are just online courses. There are CEUs for some of the courses that are there, and you always have access to your training records, and you can download them if you need to use them for extra credit, or even for your job if you want to show that you took a specific course. Sometimes, like we were teaching mass fatality response for funeral directors, and the board of funeral licensing, can't remember what the organization was, but they were accepting our course for some of their continuing education requirements. So some of the courses that are VDH courses do get continuing education requirements associated with them. So you can go to train through your account in VBHS, and I think I have some slides to show you how to do that. But let's talk about how you are activated, because VBHS is our engine that makes the Virginia Volunteer Health, makes the Virginia MRC program run. It is the backbone of everything we do. It is double backed up and secure, and it doesn't fail. If it fails, it flips over very quickly. It's very stable. I used it. If you're a new volunteer, you wouldn't have gotten it, but several weeks ago, I sent a statewide alert out communication message about COVID-19 to all the volunteers in the state. So I sent an email to 10,080 people. And surprisingly, I only got like 50 out of offices and no bounce backs, which means that our unit coordinators are doing an awesome job keeping up a very squeaky list of folks. But we use VBHS to activate volunteers. So let's talk a little bit about what that means and then how the system does it. So if you're activated, you will be activated when a request is received. So we have a lot of volunteers kind of in standby. Okay, every team, we're ready to go, but we're waiting for someone to request volunteers. Once volunteers it's recognized that volunteers are needed, then we use the Virginia Volunteer Health System to alert them and also to sign them up for a specific role or shift. So you're going to see that. It is very efficient. With an activation alert message, you will receive instructions about what you're supposed to do, if additional training is required, or if you'll be receiving an additional email with more details. So we have some different definitions of what the alerts are. So when you get an email, your subject is going to be awareness. And it might say, we want you to know what the latest is for COVID-19. Or readiness, expect to utilize volunteers for call center next week. Activation, volunteers are needed to show up tomorrow. Emergency, we need volunteers in the next 12 hours. For the most part, because we have a declared emergency, we are using all the communication coming out of VBHS as an emergency. Especially if it's an activation, we're actually deploying volunteers. And then we have a deactivation to let people know that volunteers are no longer needed for a long response. I don't think that we'll ever be sending truly a deactivation alert out for COVID-19 because we're going to be at it a long time. So you can get alert notifications for emergencies, but you can also get them for community outreach activities. When we have special trainings that are being offered, we do monthly notification drills. So if you would receive alert. Usually some units do the last Thursday every month. They send it usually around 9 o'clock in the morning, and you have 12 hours to respond. And sometimes they resend it middle of the day to make sure that you've received it. But if you don't respond to an alert, so you get a message, you get an email, or you get a phone call and you don't respond, then you will get another alert, because sometimes people don't respond and we still need more people. And when we still need more people and people haven't responded, we go and hit a button that says resend alert to people that have not responded. And so if you don't want to get notified again, then you need to go ahead and make sure that you respond in the first place. So click available, click or not available. You can also, if it's not an email, you can on the phone respond available or not available by pushing either number 1 for available or 2 for unavailable. You will sometimes receive a text message, not always, but if a unit coordinator sends you a text message, we do not have the capability to allow you to respond to a text message. So, you know, you'll get a text message and they'll usually say, volunteers are needed for the call center this week. Check email to respond. And you'll also see the reason why we need you to check the email, particularly if we're staffing for multiple days. But when you first get your first phone call from VBHS as an alert, go ahead and save that number in your contacts so that it comes across as Virginia MRC or Fairfax MRC alert, and that you don't think that someone's spamming you. Because we're not, we just really need you to respond. All right, so let's look a little bit of behind the scenes in the Virginia Volunteer Health System. So you can get to VBHS several ways. You can go to our regular VDH website, and there's a link that says the Virginia Volunteer Health System. If you type in vamrc.org, that's going to take you to the VDH website. If you want a shortcut, type in vamrc.org/VVHS, and that's going to take you directly to our system. So when you log into the system, this is what the screen's going to look like for you. If you're already a volunteer, do not go over here and register as a volunteer again. Actually, you'll find out that you cannot try to register again with the email that you previously put into the system. So you can't try that. And if you're doing that and you think, but I don't know if I have an account, then you can come over here to the Trouble Login button. You can use that button and you can reset your username and your password and it'll go there. But here I'm logged in. You can see I've entered in my credentials and I would hit the sign in button and that would let me move forward. Just want to note too, there's also a contact us button that gets you to the information for all of your MRC units, all the MRC units in the state, and you look up your MRC unit coordinator and they can help you too if needed. So when you log in, you're going to see a dashboard. It'll show you the alerts. There's your account over on the right, and then on the left, you've got deployment report and training report. So, you know, I talked about in Train, you can download your training records, but in VBHS, you can as well. And the benefit of doing your training record in VBHS is that it's going to show you the training that you did in Train, and then it's also going to show you, all the additional training that you do that's MRC recorded in the Virginia Volunteer Health System. So if you were to go to My Account, you have My Account here, My Account there, you're going to get over to a screen that shows you information about yourself. This is my guy, Zeus. I gave him a profile in the Virginia Volunteer Health System. So there's different tabs in VBHS across your profile is what we call it. You have contact information, credentials, additional information, training, deployments, and summary. So when you have a completed application, you have already completed the contact, credentials, the additional information, and the summary. The training and the deployments are going to be entered in on the administrative end, and then you'll be able to see it when you log in, so you can see how many hours of volunteer work that you have done. Our first screen shows us how many alerts you have received and then how many deployments. And actually, I've done an enhancement since this screenshot was taken, and you actually get a grade now. Underneath here, it says how many alerts have you responded available to and how many alerts have you responded unavailable to, and your percentages. So when we look at the screen, I'm trying to determine
Jennifer, we don't have the audio. I hope you can hear me. Jennifer, we don't have the audio.
Oh. No, I didn't get another phone call. I'm here. I wouldn't jump off and ignore you guys.
Jennifer, we can hear you now.
Okay, good. I don't know what's going on. I did not jump off the phone. All right, I'm gonna continue then. All right, so we're looking at Zeus's profile, and if you come under the contact section, this is the section that you would need to edit the most, and it's under contact information. And to edit any information in VVHS, you just go over to the little button that says edit, and it has a little pencil. So you're going to click on that. When you click on that, it's going to open up, and then you can change any of the information that's listed in these fields and hit save. It's the exact same function that you did when you first entered your application. All right, sounds like somebody might have their mic muted, but open. So there's two sections here about your contact information and your phone and text. So remember I was talking about, you know, getting a phone call and getting a text message. So the information that you need to have here, this phone and text alert, is important because some people say, well, I got the text, but I didn't get the phone call. Well, if you've entered in your phone here, your information here, and you've only entered SMX text, then you're only going to get the text or phone to that phone number. So do make sure that if you're not receiving text messages or phone messages, this is the one place that you want to make sure that your contact information is absolutely correct. So I already talked about that. Yay. All right. So when you get an email in VVHS, it's going to be written to you, and it's going to have a call to action. So at the very first paragraph, it'll talk about the reason why we're sending you this alert message. You can see here they need volunteers for the Special Olympics. We provide health screening and education, health services to volunteers and their communities. Yeah, I need somebody to mute their mic. The joy of doing web conferences. So when you're going to go to confirm your availability, you're going to get this alert, and you can click on that link. When you click on the link, it's going to give you information about the activity that we're asking you to deploy to. So we usually use a format of what, when, where, how, and additional information. Actually, remember we talked about 100 and 700 earlier, and there's links to 100 and 700. Yeah. I can't see right now how to mute that person. I have been unmuted by the host. Okay. Maybe the host got it.
It's gone. It's the meeting voice is gone completely.
I think she might have cut her volume off. Okay. Can someone text in the chat box tell me that you can hear me? I can only see that. Yes. Okay, great. All right, good. All right, so when you get this email, you're either going to choose I'm available or I'm not available. Blue, red button. pretty simple. When we're looking to staff something for an extended period of time, the alerts will get much more detailed.
Can't hear her.
Yeah.
No, it's not going.
I'm trying to find the person. Hang on, guys. Y'all are being like so patient. Okay, I think somebody muted her. So what you'll find if you're doing the call, if you're doing a call center right now, we will send out an alert on Thursday for the following week, and there'll usually be an AM and PM shift for an entire week. And actually, we're in some locations we're staffing on Saturdays and Sundays as well. So what you'll do is you'll just come in and you'll click available to the different locations that you're available for. If you're not available for any of them, you just go and click I'm not available for any of these. But if you're available for two of them, you're going to click both of them and say that I am available. It allows us to schedule very quickly. Now, what you should know is that you can change your mind. You can actually go back into the email that you received, and if you need to, change a selection you made. Maybe you got home and you talked to your husband and you forgot about another commitment that you have. Then you can go in and change your response. The MRC unit coordinators will lock down or expire an alert once they've received all the people that they have. And so you won't be able to respond. Once the alert is expired or all the volunteer needs are met, then it'll show 0 and you will not be able to respond. So if two people had said that they were willing to go to the Alexandria Elementary School, then the volunteer need would be 0. So just to let you know, that's kind of how it works. And we really need you to pick one or the other. And I already talked about the phone, so let's talk about Pick Me. So you got a phone message. We want you to show up to a point of testing site. You're qualified, you've done all the training, and you're really excited, you're available, you want to make the commitment, and you're like that little kid that sits in the back of the room raising their hand and saying, pick me. And we want to pick you. But we also want to make sure that you are the right person for the request. So we ask that you really do read through the instructions that you've received to make sure that this is something that you feel comfortable doing, because it's important that you're confident in performing the job that we're asking for you to do. If it's a medical position, we understand that we have some volunteers that are licensed nurses, but their license has been inactive and they hadn't really practiced in a couple of years. And that's fine. Just because you have a license does not mean that you are required to do anything. You need to let us know what you are comfortable and you feel like your training and expertise is, so that we place you in the right position. If you're assigned to a position that you're not comfortable with performing, you need to let us know. It is okay, but we need to know, because we want you to be safe doing the job that we're asking you to do. And we want to make sure that the individuals that we're providing services to are also safe as well. So no wrong in saying. Now, I love this picture because I feel like this is me almost every day at the end of the day right now. But, you know, I don't think going out and me like doing an emergency response right now would be a good idea, because sometimes we're just too stressed out. And maybe we sent volunteers, sent some nurses. I got a call. North Carolina was requesting registered nurses to go down and staff at shelters after Hurricane Florence. And we got a call, and it was Saturday at 6 o'clock, and I sent an alert out to every nurse, over 2,200 nurses in the Virginia Volunteer Health System, and we sent nurses down to North Carolina within 24 hours of receiving the request. It was amazing. There were public health nurses and medical reserve corps nurses. But, you know, you have to sometimes understand that going into an austere condition like that, and especially in a response where you're not coming home at night, and it is very stressful for long periods of time, it may not be for you. Maybe you have someone at home that's you know, going through a very difficult treatment, and, you know, it's very stressful. So maybe that's not right for you. Maybe right now, because of COVID-19, you might have some health issues and you cannot, you know, maybe volunteer public, but you could certainly answer the phone, you know, and, you know, maybe do some research behind the scenes, but you have other things going on right now that you don't feel like you could be at a point of testing site. That's okay. What I think is nice about our program is that, one, you're not required to volunteer any X amount of hours. What we ask is that you become qualified to volunteer, and what we really hope is that when an event happens that you're available and you'll come and do a really great job to serve your community. So, you know, it's okay. I like this. It's okay to say no. It's okay. Don't feel guilty. Even though you really, really, really want to help, it's okay to say no. Hopefully other people will step up and it'll all be our time. So don't feel bad about saying unavailable to something, even though you really, really, really want to help. That was kind of like me giving you a little pep talk. All right. But when you do go, you are volunteering. So there is no payment. There's no requirement. You're not like a part of an army that you're, you know, we call you must show up. We ask that when you do show up, that you are representing the MRC, so make sure you're wearing your badge. If you have one, your MRC shirt. I'm getting ready to have thousands of new MRC shirts printed and available. We usually do all have identification badges for volunteers. I always tell, definitely if you're deploying to any type of activity, make sure you have good shoes. We're standing on our feet a lot sometimes, and, you know, come dressed professionally, but definitely comfortable, you know, so that you can do what you need to do and you're comfortable throughout the day. And usually for instructions for deployment, sometimes we'll tell you, like when we send medical staff to the inauguration and they're out there in the tents in January, we're like, you know, dress in layers, you know, wear comfortable shoes, take water, you get all that as well. Have those additional instructions provided. Make sure if there's an on-site sign-in sheet that you sign in and sign out. If there isn't anything on-site, you should check in and check out with whoever your team leader is or with your MRC unit coordinator. You'll be provided with the job action sheets. Remember, I talked about that earlier, so kind of description of what you're supposed to do when you're there. And then you'll also be provided with that just-in-time training. So volunteers that are going and staffing the call centers are getting job action sheets. They're getting just-in-time training before they even pick up the phone and answer any call from the public. Doing about right on time. Here's what you have to know. Semper Gumbai. Always flexible, because the best laid plans and emergencies don't go that way. We have plans, they're roadmaps, but the road changes and sometimes it rains really hard. And sometimes we are hurrying up and we really, really, really want to go, and now we're waiting. For example, so Fairfax MRC ramped up, and the volunteers they started doing stuff at the end of February and started staffing call centers. Well, now schools are closed, and all the school nurses that were working in the schools are now staffing the call center. So now the MRC volunteers are in the holding pattern because the staff that originally were working have been reassigned to the call center. So it does change constantly. What you might be doing one day may be different than the next. It might change hour to hour, and sometimes it is stressful and tiring, but I can tell you it is incredibly rewarding work. And there's great benefits to saying yes. I mean, I love all of our red shirts. I love all of our volunteers, and many of them have become lifelong friends. It's been a great opportunity for a lot of more seasoned healthcare professionals to introduce students and younger healthcare professionals and share their expertise. So there's a great opportunity for mentoring. there's a great opportunity for volunteers that are subject matter experts to teach other volunteers. We have some volunteers that actually teach a bioterrorism course. And we know that just because you're a volunteer does not make you any less of a qualified person. You are even more qualified in my mind because you're willing to do it for free and because you're doing it in the goodness of your heart. So I'm just about right. I said 7:30, but we looked at the mission of the MRC, talked a little bit about the history, talked about public health emergency response, what we're doing with COVID-19 and what we've done in the past with H1N1, talked about responsibilities, roles, protocols, and learning a little bit about Train Virginia and the Virginia Volunteer Health System, and then what's the next steps. The next steps is that if you don't have an application approved, you'll get an email saying that it has been approved. If you have an application approved, then you get a background investigation. You don't have to do anything for background investigations. Because of COVID-19, we are able to fast track it, so you don't actually have to have your signature notarized. It's very smooth. So we've got that all taken care of. We'll have to figure out identification. You might be picking up your identification when you report to where you're being mobilized. That'll all be coordinated by your MRC unit coordinator or the person that's assisting you. There might be additional online training. You will be mobilized. You will be activated if you're needed using the Virginia Volunteer Health System, so you'll get that. And then we will have demobilization. When we do demobilize, you'll get an email following your deployment, asking how things went, if you were okay, if you need anything, if there's areas that you think could be improved, because we're constantly trying to improve our abilities to respond in an emergency and to meet the needs of our community. So with that, I say thank you for choosing to be a volunteer with us, to being willing to step alongside and with us in our efforts to defeat COVID-19. It is going to take an army. It is going to take all of us, everyone in the Commonwealth, to do their part for COVID-19. Now, don't leave yet, because if you want to get counted for being here, this is my roll call. You have to email either your unit coordinator. So if you're in Fairfax, that's Paula. If you're Prince William, that's Amy. If you're South Central, that's Katrina. I can't remember. David Woods is in Chesterfield. Chris Reaney is Northwest. So whoever your unit coordinator is, you can email them. In the email, include your first name and last name, and in the subject say I attended. I mean the ED on there, didn't I? I attended orientation, Virginia MRC Rocks. And then if they get that, then we will document in the Virginia Volunteer Health System that you completed orientation. And once orientation's done and your background investigation is done, then you become a deployable volunteer, and then you'll start receiving the deployments. So I really appreciate your time. I've kind of asked answered some questions. Let me see if I can go. For Arlington, that's Christina Crispio. Yep, so she's the coordinator. Where can you get their email address? So if you go back to that orientation page, at the very bottom of the orientation page, it says your contact information for your MRC unit coordinator, and you can click there, and that'll take you to the list of all the different MRC unit coordinators, and it'll have links to their email. But typically, we have a generic email address. So if you emailed like arlington@vamrc.org, that'll go to Christina. If you email peninsula@vamrc.org, that's going to go to Olivia. So we do have that kind of as well. So, okay. Have volunteers been deployed for COVID in other countries? That's a good. Fairfax is Paula Rosca. Let me go back to the other countries thing, because that's a good question. So the Medical Reserve Corps program is a program in the United States. They don't have Medical Reserve Corps programs in other nations. Nothing like what we have here. So MRC is just for national response efforts. So when events are very large, sometimes states can send volunteers and staff from its own state to, say, North Carolina. But we don't send volunteers outside of the United States. So, like, I had somebody when Haiti, right? They said they wanted to go to Haiti and assist responding, and they it's USAID and I think it's International Red Cross that is responsible for out of international aid. And so we're not a part of that. So we don't go internationally. Now, inside the United States, they've been doing very similar to what we've been doing. Like I said, been so focused on Virginia, I haven't really looked at other states. You can follow Virginia Medical Reserve Corps on Facebook, and then there also is the just Medical Reserve Corps on Facebook, the national program. And if you follow those two Facebook pages, you should see pictures and get an idea of what volunteers are doing around the state. All right. So there's not a handbook for Western Tidewater. You'll have to get in contact with Connor because he is updating his. Let's see. All right. Katrina Sharon and Katrina Broner is the same person. She got married. Okay, when we go on assignment from home, okay, so if you're just going on a day assignment, the unit coordinator, when you're deployed, will tell you whether or not you need to bring meals or not. When you're deployed to something like Florence, all of your meals and all of your meals are going to be taken care of. We actually took care of everybody's travel and everything, but the logistics and what's provided to you will be told to you when you're deployed. And always, if you have any questions, definitely ask that when you're deployed. What will EMTs be able to do as MRC? So EMTs have a certification under their OMD, their medical director within their EMS council. And that certification is only good when they're underneath that OMD. So you can't be say if you're a paramedic, okay, you're a paramedic with your EMS council, say your EMS council is, Loudoun or, I don't know, Albemarle County EMS. Okay, so when you're a Medical Reserve Corps volunteer, you can do first aid. You cannot be a paramedic. You cannot provide care to that level. You can only provide care to that level if you were affiliated with that EMS council. There's a lot of things that we need done as Medical Reserve Corps, part of our mission that requires first aid or requires a medical background, that having a background as an EMS provider would be helpful, but we don't do EMS work. That's EMS. Okay, if you can't get logged into VVHS, you can email me at the vamrc@vdh.virginia.gov. Tell me your first name and last name, and I'll reset your username and password. No problem. We can fix that. We're not doing anything about the blood donation storage. That's not ESF 8. Red Cross put out a huge call today with the governor requesting folks to donate blood, and actually after the press conference, the governor went and donated blood. So, that is definitely a need, absolutely. What other roles RNs play during this outbreak? Well, registered nurses are helping to answer questions and do triage of individuals that are calling with potential symptoms to the health department. And we do prefer that we have healthcare providers and licensed professionals doing that more case kind of management and working with those individuals to decide whether or not they need testing or not. So registered nurses are doing that. We will have a huge push for vaccinators. So there's some trainings that are required for vaccinators. And so that there is, definitely a need. There's a need last year for vaccinators. We'll need to quadruple our number of MRC volunteers that can be vaccinators for this upcoming year for flu and COVID-19. Let's see. Oh, yeah, Inova looks like it was having blood donation. I'm just trying to look and see if there was a question that was specifically to me. Okay, you can make changes to your application. I can't see who's asking it. So you can make changes to your application on your contact information, but if you need to transfer, if you're not in, if you didn't sign up for the correct place where you live, send me an email to va.mrc.org, first name, last name, and tell me where you live, and I'll just transfer you. And we do that quite frequently. I've moved, I don't know how many volunteers in the last week because, oh, I've now retired and now I live in Richmond. I used to live in Newport News. No problem. Just send me an email and we'll get that taken care of. The Train account will be linked within 24 hours. And there is information on our website about Train, and I will put that back on that orientation page. Okay. I think I've gotten through most of the questions. We haven't done remote call centers yet just because we haven't set up the infrastructure. We do have like a centralized call center in Richmond, but for the most part, they are in person, and I'm sure that they are probably starting to space those call center places out to try to maintain that 6-foot distancing. Oh, if you have PPE trainer or fit testing, we need you. Yes, please definitely put that in your application, but when you get approved, let your MRC unit coordinator know, because we are looking for volunteers that already are fit tested or can provide fit testing. We have volunteers in Virginia Beach that are going to go around and do fit testing for all of the first responders in the city of Virginia Beach. So we could definitely use folks that have experience with fit testing. This presentation is already posted. You can go on the website, vdh.virginia.gov/MRC/orientation, and it will be there, and all the links will be there as well. All right, 7:31, let's see. On the website, yep, thanks. Someone put the contact information. Thank you, everyone. Have a good evening. Thanks for volunteering. Let us know if you have any questions.